Good. Yeah. Okay. All right. Well, let's go. Let's go ahead and get started. Well, thank all of you for being here today. Appreciate everyone being here, and today my colleagues and I on the Energy and Commerce Committee, as well as the Ways and Means Committee, are holding some of the most powerful health insurance companies in America accountable for increasing healthcare costs and denying medically necessary care. These are 5 of the nation's largest health insurance company CEOs that touch nearly every part of our healthcare system, and the result is a system that is less affordable, less transparent, and harder to navigate. We have a hearing going on right now in the Energy and Commerce Committee with these CEOs. And Diana Harshbarger, who is here and will speak in just a second, and I've already had the opportunity to ask them questions, and I can tell you we're not holding back on them. They need to be answering us. Across the country, Americans are paying more in premiums, more out of pocket, and more at the pharmacy counter, while at the same time seeing fewer choices and more restrictions on their care. Yet since the passage of the Unaffordable Care Act, the stock prices of these health insurance have increased by over 1,000%. Let me repeat that. Make sure you hear that. The stock prices of these insurance companies since the Unaffordable Care Act went into place, they have increased over 1,000%. In 2024, the 7 largest insurers raked in $1.5 trillion in revenues and reported $71 billion in profits. Folks, you want to know why health insurance is so high? This is the reason why. That raises a very basic question. Is this a system designed to serve patients or the company's shareholders? It shouldn't be controversial to say that health insurance exists to serve patients. But too often today, it seems like the patients are the ones who are serving the system. Under President Trump, we've seen significant strides to address the high cost of prescription drugs, including Trump RX and the recently announced Great Healthcare Plan. While these developments are promising, insurance companies themselves must change how they operate, particularly when it comes to consolidation and vertical integration. And you all know what I'm talking about, where the insurance company owns the PBM, that owns the group purchasing organization, that owns the pharmacy, that owns the doctor. We were just talking, Rick Allen and I, my colleague from Augusta, Georgia, we were just talking. The largest employer of physicians in America is an insurance company, United Healthcare. They employ 9% of all physicians in America. Now, there's nothing wrong with working for United Healthcare, but the largest employer of physicians in America is an insurance company that, oh, by the way, also owns a bank. What the hell is an insurance company doing owning a bank? They are owned by insurers and have vertically and horizontally consolidated their businesses on doctors, pharmacies, group purchasing organizations, and more. After nearly 2 decades of consolidation, the PBM industry is now dominated by 3 companies that control 80% of the market. We're also seeing insurers use complicated financial arrangements, including offshore entities, to retain rebates and profits that were meant to lower costs for patients and employers. These structures make it harder to see where the money is going and harder to ensure that savings are reaching the people who need them. We also know that each year insurers receive trillions of dollars from the government to deliver care to American patients, yet benefits for patients are worsening as they encounter more barriers to access. You know, when at the end of the day, we all want the same thing, whether you're Republican, a Democrat, or independent. We want accessible, affordable, quality health care. Insurance companies are prohibiting us from having that. Insurers are simply being asked to do their job and invest in patient care, not waste money on overhead costs. These policies don't operate in a vacuum. They have real impacts on people. And pharmacy owners, some of whom are with us today, I want to recognize Jim and Kimberly Richards. Jim and Kimberly are here. They run Corner Pharmacy in Chatsworth, Georgia. They've been pharmacists for more than 25 years. The family's pharmacy has served that community since 1967. Jim, Kimberly, and their team know their patients by name. They provide vaccinations, they deliver health assessments, and they personal support that big chains simply cannot match. But in recent years, Jim and Kimberly have seen their business and patients squeezed by PBM practices like low reimbursement, clawbacks, and insurers steering longtime patients away from the pharmacy that knows them best. Even worse, Jim and Kimberly spend countless hours helping patients fight denials and limited formularies just to get their medicines to their doctors prescribed. We're also joined today by Leroy Strickland of Clayton Pharmacy in Bremen, Georgia. Leroy, thank you for being here. Clayton Pharmacy has been a pillar of its community for nearly 60 years, and under Leroy's leadership, it continues to serve not just as a pharmacy, but as a true community hub. Yet Clayton Pharmacy is being pushed to the brink by PBM clawbacks and reimbursement rates that make it harder and harder to keep serving patients. Luckily, putting patients first isn't rocket science. It's simply requiring sharing savings with patients at the pharmacy counter. Congress has a responsibility to make sure our policies encourage that kind of behavior. One important way to do that is by advancing strong PBM and insurance reforms, such as the PBM reforms policies that are included in the spending bill that we hopefully will be voting on later today. As a pharmacist, I've seen PBMs abuse patients firsthand and believe that the cure to this infectious disease is transparency, competition, and accountability. That's why I introduced the PBM Reform Act earlier this Congress, and I support the PBM provisions that are included in the spending bill that we're going to be voting on this afternoon. It's past time for Congress to put patients first by passing this important PBM reform. Again, I want to thank all of you for being here today, and at this time, I want to recognize the members of Congress who are here with us and give them the opportunity to speak. First of all, the youngest pharmacist in Congress, Representative Diana Harshbarger. She is a representative from Tennessee, is vice chair of the Health Subcommittee of Energy and Commerce, and just finished, as I say, in a hearing where we heard from the CEOs of 5 of the insurance companies. Did an outstanding job with their questions. Diana?
Thanks, buddy. Appreciate you. Well, there's only 2 of us in Congress, 2 pharmacists, and you know, you can't fix a problem if you don't understand it. And what the vertical integration has done, it's taken the power away from small businesses like your all's pharmacies. And you know, and as a independent retailer myself, I've seen the crushing. It's crushing the healthcare with the premiums, the deductibles. Those are all going up, but so are the salaries of these CEOs. And it's going to be a beat down today on those insurance company CEOs. When they're finished with our committee, they're going to Ways and Means, and then they'll probably have something going on in oversight, and then they may even have something in judiciary. What's going on today is we just came from that hearing where Republicans are demanding answers from these CEOs and the price gouging and the monopolies they've created with PBMs. And they didn't say a whole lot when we did question them, because I don't think they know the answers. Their companies are extorting small businesses and physician groups. So, you know, they're going to try to spin their way out of it and say that they aren't the bad guys, and that's what they did. But that's not going to work, because it's the rebates. They can't answer where do those rebates go through its PBM when they own the pharmacy counter, they control physician referrals, and they are the biggest owner of physician groups in the country. 10% of physicians are ruled by these insurance companies. They answer to the insurance companies. And these referrals and increasing control, they're controlling the data behind the decisions. And let me just make one statement. If you don't remember anything I say, remember this. That's not competition. That is control. And they control the healthcare system. And I don't even know why we call it healthcare anymore. It's health insurance. That's what it is, ladies and gentlemen. That's what it is. And the spread pricing, the rebate schemes, the take it or leave it contracts that us pharmacists have to endure. They're draining billions from Medicare, Medicaid, and its employees, while patients are left paying more at the pharmacy counter. And they can tout all these decreased prices in these IRA drugs or what they're negotiating, but I read an article the other day that they're just going to raise prices on the deductibles and on the generics. So they're not going to go down without a fight. And so they're going to try to recoup that money from somewhere. Independent and rural pharmacies are being pushed to the brink of closure. And we get closures every day in my district, and I have a rural district. And it's because of the PBMs reimbursing them below cost. How many times have you been reimbursed below cost? If you're underwater, why would you dispense something? It's a shame. And you have to send them to a chain or to an affiliated pharmacy with these insurance carriers to get that medication. When a pharmacy shuts down, a community loses. They lose access, and especially the seniors and the rural patients with nowhere else to go. PBM reform that Buddy was talking about and has been a champion of is about restoring fairness and transparency and competition. I don't think they could give you the definition of competition. We've got to ban their abusive practices. We've got to end spread pricing. We have to ensure that those rebated savings go directly to the patient and the plan sponsor. Not these insurance companies that, even our colleagues on the other side, they were talking about that they have record salaries. And, you've got somebody deciding whether they're going to eat or they're going to pay for their medication, but they're raking in the money. That's why they do have a bank, Rick Allen. That's exactly why they have a bank. And it's not a partisan issue. Patients, pharmacists, employers, and taxpayers all lose under the current PBM model, and Congress has a responsibility to step in when a system is broken, and this is broken. And we do have solutions, so we're going to keep fighting to regain control of the healthcare system that's going to be fair for those little patients, for our providers, and for those pharmacists and those practices. Because as I tell my colleagues, we're going to go back to the old concierge system where somebody's going to bring me a chicken for their blood pressure medicine, and I'm probably going to take it, especially if it's a laying hen. I'm probably going to do that. That's the way it used to work. But we are at the cusp of changing the way healthcare is controlled, and now they're going to have to answer to Congress. And we appreciate you being here today, and I appreciate all the people behind me that support not only pharmacy but healthcare in general, because if a rural pharmacy closes or a rural hospital closes, it really doesn't matter what kind of insurance you have, does it? Because you're not going to get the care that you need. So we have to fix that. And so I guess I'll turn it over to Nicole Malantakis from New York.
Thank you very much, everyone. I want to thank Buddy Carter for his leadership, as well as my colleagues who are here with us today, because this is an incredibly important issue. When we talk about affordability and health care, we know that it's the insurance companies and the pharmacy benefit managers that they own that are the reason why prescription drugs are so high and why health insurance premiums are so unaffordable. These bad actors, I'm going to call them bad actors, they have vertically integrated the healthcare system in a way where they are the insurer, they are the PBM, they are the pharmacy, and they sometimes are even the doctor. And they're controlling each and every step of the process. They're not being transparent, and they are pocketing a lot of money at the expense of taxpayers who are often subsidizing these plans, and at the expense of patients. I can't tell you how many small mom and pop pharmacies in my district are going out of business because you have the PBMs that own pharmacies dictating what their competitors can make. It is a ludicrous system. We as a Congress need to end this practice of vertical integration, and we need to break up these monopolies because it is really having an impact. That's the number one thing we can do. But today, we are taking a very significant step, and it's taken us a while to get here. And I'm proud as a member of the House Ways and Means Committee to be a leader on this bill with Buddy Carter that will actually really rein in these insurance companies and PBMs, and will make sure that they're not just unilaterally deciding what kind of profit they're making at the expense of taxpayers and patients. So this is a tremendous step. We got to keep pushing. There's more that needs to be done, but this is, after years of fighting, and I fought, by the way, as a state representative too, okay, this is the most significant piece of legislation to stop this type of abuse by these insurance companies and these PBMs. And I'm very happy that we're going to take this big step that's going to mostly protect our senior citizens. Senior citizens who oftentimes need these drugs to survive. They can't pick and choose whether they can take some of their medication. Okay? And it shouldn't come to that. We need a healthcare system that works, that's affordable, and we're going to rein in these guys today, as the Energy and Commerce Committee did earlier with the big 5 insurance companies. We're going to see them in the Ways and Means Committee hearing room later today, and then we're going to pass this bill on the floor of the House of Representatives and Senate, and send it to President Trump, who we know is in this fight with us to make healthcare more affordable in this country. Thank you very much. I yield back.
Thank you. Now we're going to recognize Representative Rick Allen, who is also a member of the Energy and Commerce Committee, as well as the subcommittee chair of the Health Subcommittee of Ed and Workforce.
As Congressman Carter said, thank you for being here today, and I want to thank my friend Buddy Carter for organizing this press conference today. As you can see by the unified group of members and advocates behind me, PBM reform and bringing down health care costs for American families is a pressing issue, not only in my rural district in Georgia, but across the nation. I come from the business world, and ensuring my employees had access to affordable, accessible health care was always a priority of mine. So let's talk about health care. As Congressman Carter said, I chair the Health Committee in Education and Workforce, which has jurisdiction over ERISA, or employer-based insurance. What I wanted to ask those insurance companies in there today is, do they self-insure? And what is your cost per employee to self-insure? What I am proposing is that we allow every state to get a waiver, like the unions. You got to understand, the unions and the faith-based community got a waiver from the Affordable Care Act. Now, the reason the faith-based community got a waiver is because the Affordable Care Act covers the cost of abortions, and they weren't going to be any part of that. So they got that waiver. But the unions got a waiver. I wonder why. In fact, we hear all the time the unions offer incredible health care insurance at a very, very low cost. So what I propose is that we have a waiver for every state to have the opportunity to provide their citizens that opportunity. Why shouldn't every American have the opportunity to pay $76 a month? This is the data that's out there. So then you ask, well, where's all this other money going? Well, our Democratic colleagues say we need premium support. Well, it's only going to cover a small bit of the increase, which we just heard about from the insurance companies, number one. And number two, that's like standing in a bucket and trying to pick yourself up. It's coming from the taxpayers. Actually, it's not coming from the taxpayers. It's being added to this enormous debt that we already have in this country. It is insane. So let's talk about PBMs. This has become an increasingly difficult over the past several years, in large part due to bad practices. Community pharmacies, which are essential critical of our rural communities, have consistently pushed for transparency into PBM operations and reforms to their tactics. I have heard about it time and time again in my district. All they want is a fair playing field. They can outprice anybody in the business. Just make it fair, a fair playing field. We could, and again, you're trying to eliminate competition. Let me tell you, I was chairman of the board of St. Joseph Hospital for 9 years in the late 90s. That hospital no longer exists in Augusta, Georgia. In fact, we have 3 hospitals there now, and they're managed and owned by entities outside of our city. What is going on in healthcare? They're limiting competition. Making matters worse, care has only grown more difficult for patients to afford and access. We have made meaningful strides, namely through Representative Carter's introduction of PBM Reform Act earlier this year, which I have been proud to co-lead. This common sense package would eliminate the use of spread pricing, make prescription drugs more affordable, and establish rigorous oversight over PBM tactics that threaten access to care. I, along with every member here, has been on this mission together. I am hopeful we can get PBM reform across the finish line this Congress, and we can fix health care. We can do this. The biggest untruth ever told was, we're going to reduce your premiums and you can keep your doctor. A former president of the United States said that. And these folks are in there defending that. We got to change the way we do business in this country. President Trump is on it. He's working hard. He's already working with reducing drug prices. And there's a solution. And so what we need is the American people to get behind us and get this done. Thank you, buddy, and I'll yield back.
Thank you. Thank you, Rick. Okay. We'll be glad to take any questions now. As you can see, we've got a number of members of Congress who are very passionate about this. And look, healthcare is important. Healthcare is important for everyone, and we want to do something about it. That's why we're excited about this vote this afternoon. That's why we're excited about the hearings that we're having right now in Energy and Commerce, as well as in Ways and Means. Any questions? Yes, ma'am.
Erin Durkin from Bloomberg. I was wondering, beyond today's vote, this concern about rural integration, I know the FTC has put out reports about this. Are there any ideas or plans that you all want to pursue to either try and break up these monopolies or pressure on them?
What I just proposed.
There are a number of ideas. In fact, Diana was just asking me about that. Today is not the end all. But we're glad and we're happy with the wins that we're going to get today, hopefully when this bill passes. But there is more work to be done. Right now, the FTC is undertaking a study. It's called a 6B study to see the impact that insurance companies and consolidation PBMs are having on independent retail pharmacies. We've already had 2 interim reports. We're expecting a 3rd interim report to come out very shortly, and then the final report after that. That'll give us the opportunity to have a government agency. It's been going on for over 2 years now, about almost 3 years. That'll give us the opportunity to present those findings to the DOJ. Hopefully they will take action as well. But legislatively, we've got a lot left to do. As Rick mentioned in his speech, we've got a lot of ideas out there, a lot of good ideas. And certainly, this is not the end of PBM reform or of insurance reform.
Well, I have a patients before monopoly bill. Patients before monopolies, and when in the world am I going to agree with Senator Warren about anything? But we agree on this, that there may be no other course but to break them up. And so that's where we're headed, and we'll see how this plays out. We just want them, like they said, you got to have a fair and level playing field, and competition is good for everybody because we all win in the end. So
that's why I said earlier, I applaud the president and what he's proposing with sending the money to the patients and not to the insurance companies. That's going to increase competition. You know, when I had a business for 32 years and I always provided health care for my employees, for a long time I just bought a plan and let them be on the plan. Finally, I said, hey, I'm going to give you a stipend. You go out and buy your own plan. What's best for you? That worked much better. That increased competition in the marketplace, and that was important. Anything else? Well, again, I want to thank my colleagues for being here. Today is an exciting day. It's an exciting day for all people who have insurance and need insurance, which is all of us. It's a great day for America. I especially want to thank the pharmacists who came out and the pharmacy students. Thank all of y'all, and this concludes it. Thank you.
Thank you, sir.
Thank you all. Thank you all. I really do appreciate it.